All right, welcome back to Business AM. We're looking at what the health sector has been in 2020 as we look forward to 2021. You can get involved. 21460 is your SMS line at Metropole TVKE across all your social media platforms. We're still with Director RFH Healthcare. That is Dr. Victor Nyani, that's the medical director. And we are with Oweno Stephen as well, doctor, public healthcare expert. Let's get into that conversation now from Dr. Nyani. Yes, we spoke about the possibility of a vaccine in 2020. Funny enough, they found it. We're talking about the Pfizer, Moderna, and we do expect that as we get in 2021, there are going to be more that are going to get authorized now for use. So the question is, how should the country react to the authorization of the use of the newly discovered COVID-19 vaccines?
Well, Simba, the same thing obtains. I think I've mentioned this earlier. Right now, the Western countries have, if I may use colloquial language, first dibs.
Yes.
And before the vaccines get to Kenyans, it will take, they're talking about maybe middle or even late 2021. That's the expectation. If God smiles upon us, then we may get a few doses early for those who are in critical cases. And therefore, for us as a nation, because we haven't developed our own vaccines, we don't have an option but to continue practicing the measures that we need to practice. Now, the good thing about a vaccine is that it gives us hope. Gives us hope that if we protect our parents long enough in those with chronic disease, then they live long enough to get a vaccine, and therefore they don't have to go through COVID-19, which can be disastrous for those above 65 with diabetes, with the hypertension, even younger ages with cancer and so on. And so this, the only thing it does, it makes all these measures more important so that our parents and the older people can live long enough to get access to that vaccine. Unfortunately, that access is, in my projection, middle to late 2021, principally because the existing vaccines, the existing capacity, people have already booked those. And our country, I'm not sure, maybe we'll get an update from the respective officers whether we have any hope of getting a vaccine within, in short order. And perhaps I would mention this thing I spoke about, good intentions. And perhaps there have been good intentions in many officers taking up roles of leadership in county governments and even in the Ministry of Health.
Yes.
But I want to say that good intentions are not enough. Take something extra, and that extra, to make a difference, will be to identify this extra, go by it, and ensure that structures work. The NHIS, the KEMSAs, the Health Services Commission, the supply chain, removing corruption from the health sector. And it starts by talking to the right people who have the experience and ability to, make a difference, different from those who've been making this sort of speeches for the health sector over time.
Yes, I want to ask you this question, Dr. Ngani, just before I let you off the hook on that. I mean, it's been what? It's been less than a year, and we do know that vaccines take what? They almost take 10 years to even get authorized to be used in the public population. Dr. Ngani, what is so special about COVID-19 in 2020? I mean, why haven't we discovered a vaccine for HIV, therefore? There's so many of the viral diseases that we do know that still don't have a vaccine. Why the speed at which we've seen the world move in saying, finally, we have one? Why?
Well, if you compare COVID-19 to any other disease,
yes.
COVID-19 is the number of deaths in 1 year than the leading cause of death in the Western countries. And by and large, whatever affects the public health system in the Western countries takes precedence.
Yes.
So you'll have disasters like Ebola affecting African countries. It's not a big deal. HIV has not been extensively a problem in the West, but none of those diseases, in all honesty, compares to SARS-CoV-2 and COVID-19 in terms of magnitude and impact, and also whom it involves. Also, technologies have come a long way forward, but it's important to note that despite this, as it stands now, we are not 100% certain about the efficacy and safety of the vaccines.
Yes.
They have not been tested. That's the reality. But then you don't have another alternative because for a group of people, if they don't get that vaccine and they get COVID-19, they'll not make it. And so this is a best bet. A lot of these vaccines have been authorized under emergency use authorizations, meaning that their safety and efficacy is not 100%. It's not something that has been studied long term, and there may still be effects that will be witnessed over time. Some may end up even being worse than COVID-19. But that's where we are today, and there's some hope that there is reasonable satisfaction and science to support their use with relative safety.
Pretty much, let me bring in you, Dr. Bueno Stephen, on that. Is that, well, if you look at the news that are surrounding this COVID-19 vaccines, is that there is a celebration sort of environment around that, but nobody's saying, well, but maybe approach it with some sort of caution. We haven't had that caution, knowing very well that coming up with a vaccine is a lengthy, tiresome process. Are we approaching 2021 with some sort of, we'll say, well, we have to do it. We have no other way. Is that the sort of sentiment around these vaccines?
Just on the discussion of vaccine, I'll begin from Mutai's comment on this various vaccines. So
yes,
even Mutai himself, the big man, he mentioned that also has his, sort of reservations and some uncertainty around certain types of vaccine, and he mentioned Pfizer, for example, their vaccine and how they are doing it. So the discussion around vaccines is a bit unique because like 9 different entities globally have developed vaccines using 9 different ways. And some of them are sort of doing the traditional way of lessening the disease, and some of them are going the. So there are various different, sort of combinations of how these vaccines have been developed, and what this has meant. Even there is no one vaccine for COVID-19. The vaccine sort of targets different operations, within for COVID-19. And so with this, what we are going to see, and I was reading also the other day, is that Kenya, other countries in Africa, say like South Africa and sort of the northern countries, are signing sort of commitments, are showing commitments to international bodies that they would need these vaccines come into the country.
Yes.
But when I was looking at the case of Kenya, is that Kenya has not really shown a very strong, reserve commitment. They've shown interest that, yes, we are open to the idea, but, they have not really sort of hit it on the nail that, yes, we find that we are really also on the list of countries that are waiting. And with that in place, and, with all of these uncertainties surrounding vaccination for COVID-19, just as Dr. Victor has said, is that it is even more important for us now, to continue with the government regulations and the regulations for COVID-19 and preventing COVID-19. And again, I was just reading the other day on one of these global articles, is that the way perhaps most countries will move in Africa for the COVID-19 vaccine is the way of vaccinating just enough people to be able to achieve what is called herd immunity. So there is still these different ways in which the discussion around vaccine is, and as a country, we don't still have a stellar direction in which we want to move, and as far as the vaccines are concerned, and we don't have like a clear, definite strategy for that as at yet, and therefore that means that we stick with the strategy that we have currently, which is to wash and sanitize, and keep safe, physical distancing, and all of those regulations until at such a point where we will have, more clear guidelines, more clear strategies, and more clear direction on the way to go with the vaccine. So I'd say vaccine in Kenya is a caution hope. It's not a very full hope. It's a caution hope at the moment.
All right, Dr. Ngani, just as we clear this conversation for vaccines, have we resigned to the fact that our Camrys here locally can also be part of that solution? Have we left it to first world countries to actually give us a solution for a vaccine? Is it possible that when we get into 2021, that we'll be talking about a local vaccine?
Well, actually, surprisingly, you'll find that Cambry is quite high in the in the list of organizations that does research. It's just that the research is funded by other parties.
Yes.
And we do have very good researchers within the country. We perhaps need to learn to just focus and create capacity internally, because most of these studies, even now, the multiple vaccines being tested right here in Kenya, with Cambridge researchers being part of that, that initiative. However, the ownership of those vaccines and the rights around it processes are not ours. And if we just make a small tweak to that process, we'll begin to be part of the solution. And this is a call to Africa as a whole. Let us be part of the solution, not waiting for others to give us hand-me-downs, and solutions that are not entirely ours. Sorry, I have.
Totally understand, Dr. Ngani Victor. Yes.
So yes, and we have to be part of the solutions that we are asking for. I think that should be our next frontier. In the next 2-3 years, really, if there's ever another pandemic, Africa should be at the forefront of providing solutions.
Pretty much. All right. Let's therefore look at exactly what the government spent in the financial year 2020-2021, which saw the government allocate towards achievement of the universal healthcare coverage. They allocated 50.3 billion shillings to activities and programs for the attainment of universal health coverage by the driver and enablers, 19.2 billion shillings to address and lower cases of HIV, malaria and tuberculosis in the country, 6.2 billion shillings for the management of equipment services, 5.3 billion to transform the healthcare systems for universal healthcare coverage, 4.1 billion to cater for free maternity healthcare, and 1.9 billion to provide medical cover for the elderly and severely disabled in our society. Allocations to various referral and county hospitals. Now, when you look at this expenditure, Dr. Bueno Stephen, and quickly at that, would you say that, well, we were sort of caught between a rock and a hard place because our expenditure really was not in the areas that would probably enable us to fight the COVID-19 pandemic in 2020?
Mm-hmm. So when we think about UHC, universal health coverage, the topic that comes in mind is what is the basic essential packages?
Yes.
And part of our basic essential packages, perhaps I would say not include much on, risk scenarios like, or emergency scenarios like, the COVID-19. And, that again speaks again to emergency preparedness and response, which when you review UHC, probably it could have been allocated, but not as much. And then it caught us, by surprise in 2020. So again, when you look at UHC and when we're looking at how the funding, how it has worked for COVID-19, the expectation would have been that, the essential packages ensure that people are able to access health services from the hospitals, at least the primary health services, which is really what was needed even for COVID-19 and sort of its management. But since we are still in the sort of the early stages of really getting into this UHC, then we see that despite the increase in people visiting, and using the health facilities between 2014 and then, in 2019, in 2020 we saw there was a sort of a decline in people, going to the health facilities, partly because the health systems now, there was a lot of stigma around the medical facilities. And the services all of a sudden became increased again. And some of the, services in the health system were closed out to give priority to COVID-19. And when you look at all of these competing priorities against UHC, then that is one of the reasons why perhaps, the budgeting for UHC and especially the budgeting around emergency preparedness and response in a health scenario perhaps did not work for us, this time around. And again, if we take the lessons from that now, because in the future, the thing is we are going to have more pandemics happening, more outbreaks happening. And so we have to be bolstering our emergency preparedness and response as part of, the broader UHC, agenda. And, universal health coverage, if you are able to achieve that, if you are able to ensure that the primary basic essential services are met and that the primary healthcare system is strengthened, then if that would have happened, COVID-19 would have been a very big thing, to manage and to control. And we see that in countries like Japan, where UHC is working for them, efficiently and nicely. They are able to control, outbreaks like COVID-19 because it's part of an integrated and part of a strengthened primary healthcare system.
Yes. All right, Dr. Ngani, Dr. Ngani, quickly as we come to the end of this conversation, would you say that for the healthcare system, it was sort of a surprise? Because if you look at where the government really wanted to spend in 2020, 2021, I don't think that they did anticipate that they'll be fighting the COVID-19 pandemic. And does that speak to the general preparedness of the health sector towards fighting anything that might arise within a year?
Simba, I was going to say this, that the figures you've quoted,
yes,
that's actually a lot of money. And initially, as chairman, I used to think that part of our problem was that you are underfunding healthcare. But later on, when I sat down, I actually realized you're putting significant amounts of money, not enough, but even that which you're putting in, the question is how we're utilizing it. Is it being used effectively? Yes. And I guarantee, if you had spent this money you've quoted the way it's meant to have been spent, the health system would have been much better over time. ICUs are not just for COVID-19. You'd have created that a long time ago. Healthcare workers being available is not something for COVID. Could have been there a long time ago. And the only thing we're talking about would be PPE and isolation centers. But in fact, we are coming in at a time when the system is broken. People are dying for lack of oxygen. And it's largely because if you look at all these monies you've spoken about, you'll find very many small cancers in that discussion. It's like, that's a real problem. And until we move away from that view that public money for healthcare is money for people to take and go and buy cars and go on holidays and stuff, until you move away from that and use that money to build health systems, will not make progress. I think that's the biggest challenge you're facing.
All right.
And it affects both government officers and also healthcare workers. We have to look at ourselves and be sure that we are working with integrity in our places. All
right, Dr. Ngani, just before I let you go there, summarize it for us, what is the outlook of the health sector from where you sit now in 2021?
Simba, I love that we're having these kinds of conversations around healthcare, because what we need to do first is begin to talk. And people also to hear, it's not just for the doctors. Our working healthcare system is for every single person.
Yes.
It should be a concern if the system is not working. And so these conversations give me hope. I've learned to be cautious because I've been hopeful from 2011. There's been very little progress.
But a long time, isn't it?
A long time. So I hope that we'll actually make progress in 2021 and deal with corruption and allocate, give healthcare priority.
COVID-19 became a lesson?
For me, yes, but I hope it's a lesson for our country. And as a result of COVID-19, we'll say never again. So if you don't say never again, then it's deaths plus a wasted opportunity.
Pretty much. All right, Dr. Ogweno Stephen. Outlook for the healthcare sector in 2021?
To add on to what Dr. Victor has said,
yes.
For 2021, I see an increase in priority and attention for non-communicable diseases, especially as a lesson point from COVID-19, because we see that around 17% of people who are dying from COVID-19 was a result of diabetes. And this is not even putting into account hypertension, high blood pressure. And what even the World Health Organization is fronting is that non-communicable diseases became a huge contributing factor to why people are dying from COVID-19. So if lessons are anything to go by, what I see working for the healthcare system for 2021 is also having an increased priority and sort of attention to the management and the control of non-communicable diseases. And this is to ensure that then we are able to strengthen, that area as well. The other thing I see as a priority for, 2021 moving forward is there'll definitely be a priority on the healthcare workers and on the strikes. I really hope that happens, that there's a priority on really getting those deals done and achieving that, but also a priority on building public trust, because even when the vaccine will be out, for 2021, even when Kenya shall have brought that in, the only way we are going to move forward with that, and the only way people are going to take in those vaccinations, is if there's a lot of public trust that has been built between the healthcare stakeholders and the community, communicating on the safety, on the importance, on the working mechanisms of this vaccine. Because without that, then what we are going to see is that we may have the vaccines at hand, but people will be resistant to go and use them. So those are some of the key areas that I'm seeing the government need to focus on for 2021, especially in the health outlook and even the private stakeholders. And finally, also an emphasis on capacity, continuous capacity building for the healthcare workers, the community health workers, the public health workers, the workers at the hospital, an increased continuous education program that is really revamped to ensure that we are able to keep up with the upcoming trends and that we are able to adapt into the upcoming health scenarios as the world changes. So thank you.
Pretty much. Dr. Victor Ngani, Medical Director, RFH Healthcare, and Dr. Weno Stephen from the entire of Metropole Television. We would like to thank you very much for being a part and parcel of us in 2020. We wish you a Merry Christmas and a prosperous, happy new 2021.
Thank you.
And for everybody watching, good morning to you too.